Well, coronary artery disease is really an epidemic in this country. It has been for years, and it's still on the upswing as more and more of our population becomes diabetic and obese. This disease is really not going to change until we really share with the public what we know is the causation of this disease. And then what we're doing is empowering the public to know how to absolutely make it so that this disease never has to occur. And in those where it is in existence, it never has to progress, and they can begin to reverse it. It's interesting that the reason we feel so sure about the power of whole food plant-based nutrition is that right now we in medicine have to sort of hang our heads in recognition of the fact that we have built a billion-dollar industry in this country around an illness that does not even exist in half the planet. I mean, if you were to try to practice cardiovascular medicine in Okinawa, rural China, the Papua Highlands in New Guinea, Central Africa, the Tarahumara Indians in northern Mexico, forget it. You better plan on selling geraniums. You're not going to have any patients with heart disease. Why? Because they all thrive on whole food plant-based nutrition. Well, that's simply the way that the medical profession has evolved here. We, with all due respect to my cardiovascular colleagues, who I so admire for their compassion, their caring, and especially their fund of knowledge, but there's never any essential knowledge about nutrition that is being taught in medical school, and even less in the postgraduate training of cardiologists. Yes, they do learn a lot about drugs and pills and procedures like stents and bypasses, but those are just sort of stopgap measures that treat symptoms and have nothing whatsoever to do with the causation of the illness. So the illness marches on. And there's a great deal of emerging data that are really quite clear about how it is that we never have to have this disease, and if it does exist, why it never has to progress. Breast cancer is interesting about its formation, and interesting that obviously there seems to be ways that we do with whole food plant-based nutrition. We protect patients from having the genes that are going to turn on cancer are not inspired to turn on. As a matter of fact, the genes that turn off cancer are enhanced by whole food plant-based nutrition. You have this combination of things. Actually, it was my friend Dean Ornish that with prostate cancer pretty well clearly showed this. When he took patients with early stage prostate cancer and indeed just put them on whole food plant-based nutrition, and their disease was halted, and often actually in the early stage cancers was somewhat reversed. And this is extremely powerful. This whole idea of epigenetics, about turning certain genes on, turning genes off. The cancer producing gene, you turn it off with whole food plant-based nutrition. The cancer producing gene you turn on with the animal-based Western diet. And I think that it's really rather striking when you see that what happens to Japanese women when they migrate to the United States. By the second and third generation, still pure Japanese American, they now have the same rate of breast cancer as their Caucasian counterpart. I think the saying that is easiest to remember is that genes loads the gun, but lifestyle pulls the trigger. Absolutely, it's possible to prevent and reverse heart disease, no question. And our own research, that of Dr. Dean Ornish, that of Dr. Robert Ostfeld, and many others who really have now shown by scientific publications in the peer-reviewed scientific literature that we can take patients who are seriously ill with heart disease. They've been told nothing further can be done. No more drugs, no more procedures. They can absolutely stop the disease and begin to reverse their symptoms when they go to a whole food, plant-based nutrition. Now, it doesn't work if somebody says, well, I'm 85% there or I'm 90% there. No, because I think it's probably important, if we've got a moment, I want to just spend on where all experts agree that where this disease has its inception and its onset and its beginning is when we progressively injure that innermost lining of the artery, the endothelium, which is the absolute life jacket and guardian of our blood vessels. And what makes it so remarkable is it produces a marvelous molecule of gas, nitric oxide, which has a number of truly remarkable functions. Nitric oxide for us always keeps our cellular elements in our bloodstream flowing smoothly like Teflon rather than Velcro. It keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide keeps the wall of the artery from becoming thickened, stiff, or inflamed, protects us from getting high blood pressure or hypertension. Number four, this is the key, a plentiful, normal amount of nitric oxide will protect you from ever developing blockages or plaque. So literally everybody on the planet, whether they are from Chicago, Berlin, London, New York, Melville, Long Island, wherever they develop their cardiovascular disease, it's because by now in their life, in the preceding decades, they have so sufficiently trashed, injured, and compromised the capacity of their endothelial cells to make nitric oxide. They simply don't have enough to protect themselves from making these blockages and plaque. Now, the good news here, though, is that this is not a malignancy. This is a benign foodborne illness. I've often said coronary artery heart disease is nothing more than a toothless paper tiger that need never, ever exist. And if it does exist, it need never, ever progress. This is a completely benign foodborne illness. Now, the exciting thing is that once you can get patients to stop ever eating again any of these foods that are going to injure the capacity of their endothelial cells to make nitric oxide, then the endothelial cells recover. You make enough nitric oxide so you can absolutely halt disease progression and begin to get disease reversal. Now, what are those foods that every time you eat them, you injure the endothelial cells? Any drop of oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a salad dressing. Oil injures endothelial cells, as does anything with a mother or a face. Meat, fish, chicken, fowl, turkey, eggs, and anything that is dairy, milk, cream, butter, cheese, ice cream, and yogurt, and any excess of sugary drinks, Pepsis, Cokes, Diet Colas, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. So if you eliminate these foods that are going to injure you, what are you going to eat? You're going to eat all these marvelous whole grains, for your cereal, bread, and pasta, and bagels and rolls, 101 different types of legumes, lentils, and beans, all those marvelous red, yellow, and green leafy vegetables, and white potatoes, especially sweet potatoes, and some fruit. Now, there's one other wrinkle here that we've added in the last 6.5 years, and that is that if I can get a patient to imagine if they could get their heart, excuse me, if they could get their head inside the artery to their heart that is diseased, they would see that that is an absolute cauldron of oxidative inflammation. So we need antioxidants. No, do not go down to the health food store and buy a jug of pills that says antioxidant, because it doesn't work and it's going to be harmful. So you're going to get your antioxidants from food. Fair enough? What food? Food that is high in what we call ORAC value, O-R-A-C, oxygen radical absorptive capacity. So if you're having raspberries, blueberries, strawberries, and blackberries on your morning oat cereal, terrific. But nothing can trump the antioxidant value of green leafy vegetables. So I want these patients seriously ill with heart disease to start chewing a green leafy vegetable 6 times a day after it has first been boiled in water, 5.5 to 6 minutes, so it's nice and tender. And then you must anoint it with several drops of a delightful balsamic vinegar. Why? Because the acetic acid in the vinegar has been shown to restore the nitric oxide synthase enzyme contained within the endothelial cell that is responsible for making nitric oxide. So you're going to chew this alongside your breakfast cereal, again as a mid-morning snack, again with your lunch and sandwich, that's 3, mid-afternoon 4, dinner time 5, and I adore it when you have that evening snack of kale. What are you doing? All day long you are absolutely basking and bathing that horrible oxidative cauldron of inflammation with nature's most powerful antioxidants. Now, what are the green leafy vegetables that I'm talking about? They are bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, Napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula and asparagus. And the top 6 are kale, Swiss chard, spinach, arugula, beet greens, and beets. And that's how you halt and reverse heart disease. It's not 90%, it's not 95%. That's not my program. It's 100%. Think of it this way. If you have the disease because you have so destroyed your endothelial capacity to make nitric oxide, why would you ever, 5 or 10% of the time, continue to try to further destroy the endothelial capacity to make nitric oxide to have another second heart attack? Makes no sense. And what are you doing? You're exchanging one pile of delicious food. The Western diet is no question. It looks delicious. It smells delicious. It tastes delicious. And it is painless while it is injuring you. And you exchange that for whole food plant-based nutrition, which looks delicious, smells delicious, tastes delicious, and is absolutely enhancing your health. Now, people will say, how am I going to get my protein? What? There is protein in grain. There is protein in beans. There's protein in vegetables. There's protein in potatoes. You're not going to be deficient in protein. Increasingly, professional athletes like Kyrie Irving for the Celtics, plant-based. Why? Just like the 11 members of the Titan football team. Going plant-based, why? Greater stamina, quicker recovery time. Pretty exciting. Strongest man on the planet, Baboudian, a German, lifts 1,200 pounds. What? Plant-based. Well, I think the best data there would be the earlier studies of Dr. William Castelli, who for many years was the director of the world famous Framingham study. And in that, this is a community outside of Boston. In all those years, I think he had said that nobody who regularly appeared with a cholesterol of 150 or under had cardiovascular disease. And my own biased feeling here is that in addition, those are people who had very little in the way of inflammation. And if you get the combination of people who are happening to be eating whole food plant-based nutrition, they not only will they usually lower their cholesterol, but most important of all, whole food plant-based nutrition is one of the strongest anti-inflammatory maneuvers that you can possibly do. I mean, when you're eating whole food plant-based nutrition, your white blood cell count, which is normally in Americans is 5 to 10,000. If you're plant-based, it may suddenly drop to 2,500 or 3,000. Your doctors will start scratching their head, worrying if something's going wrong. No, the inflammation has left your body and it plummets. Same thing happens to your HDL cholesterol. As you start eating whole food plant-based nutrition, your HDL cholesterol falls. Why? Because your liver is somehow, the message has gotten to your liver that as the inflammation is leaving your body, you need less of this highly anti-inflammatory HDL molecule. Well, actually, it's interesting that you have to sort of tell both stories. The first study I did was, it was not major in the sense of being large. I think it was major in the size, from the standpoint of what we were able to show. This was started back in 1985 when when I asked the Department of Cardiology to let me have approximately 24 patients who were seriously ill with heart disease, and I was going to try to see if I couldn't get them to eat whole food plant-based nutrition. And a bit of background. The concern I had was that I was not a clinical psychologist, and my worst fears were that the patients would not comply. And therefore, I decided that I would try to use for them the same mantra that I had been using for my cancer patients for years, that I had learned from Bert Dunphy, who was a marvelous West Coast surgeon. And Bert used to say that patients with cancer are not afraid to suffer. Patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their family or by their physician. So for the first 5 years of that study, I saw every one of these patients every 2 weeks in the office, where we would go over every morsel they ate, check their cholesterol, weight, and blood pressure every 2 weeks. At the end of 5 years, I got a little bolder about this, and I stretched it out to every month. Now, most cardiologists see their patients otherwise stable twice a year. So by the end of a decade, these patients were now pretty well on autopilot, and I was able to stretch it out to quarterly. And then at 12 years is when we wrote them up and published our results. And it was really quite striking to see that these patients who, interestingly enough, in the 8 years prior to coming into our study, the 18 patients who stayed with us through the entire 12 years, they had, in the 8 years prior to coming into our study, while in the hands of expert cardiologists, these 18 patients had 49 cardiac events of worsening disease. Once they came into our study, over the next 12 years, these 18 patients, 17 of the 18 had no further events. We did have one little sheep who wandered from the flock after 6 years. Got into the lamb chops, the French fries, the glazed donuts. More angina, had to have the bypass, but now he's back with the flock, but proves the point that I'm trying to share with you today. So the first study was really fairly long, about as long as you'll ever see any study. It's almost a half a career, 12 years. And it was so provocative that these results were, not only could we stop the disease, but we often saw measurable examples of disease reversal. And it was just the other day, one of the patients who had been told that when I started seeing her, and she was in her late 50s, she'd had 2 heart attacks and she was told to go home and get a rocking chair. She lived over 30 years, just died, 90. Now, the quality of life for these people was so different because once they get on this program and they begin to see their symptoms and their angina, everything begin to disappear and get better, it is absolutely so empowering because they recognize that not the pills, not the procedures, but what it is that they themselves are doing. They have become the locus of control to absolutely annihilate this disease that was trying to destroy them. And how do they do it? With absolutely delicious food. pretty crazy. Now, the second study that we got in, because in all due candor, our study really upset a lot of people because the status quo was being challenged. Now, with all due respect, physicians are making a very handsome living for those who do stents and bypasses. And suddenly, what would happen if these, if these weren't needed? Yeah. So our critics said that Dr. Esselstyn, it's interesting that you've got these results with these small number of patients, but your diet is pretty extreme and strict. And what makes you think you're going to be able to do this with a larger group, and do you ever get similar results? So in July of 2014, in the Journal of Family Practice, we published, this time, a study of some 200 patients. And 2 of them had been lost to follow-up, so we had 198. Of the 198, 177, 89.3%, almost 90% were adherent to this diet, which is, we're told, is extreme and strict, but made up of delicious food. And what happened was that we followed these patients close to 4 years. And this time, of all those who were adherent, 1 patient had a stroke. If you measure the major cardiovascular events, heart attack, stroke, and death, 1 patient had a stroke. So we had the data, and again, the same things that we were seeing that we were told wouldn't happen. So it was replicated. And so it's very exciting and very inspiring for patients to know how powerful it can be for them to make this kind of commitment and make it happen. Now, sure, it's challenging because every time you do anything socially in this country, there's going to be food. And it's always going to be, without question, food that's going to injure you. So it's a challenge for these people. But if you're going to have a lifestyle change, as a physician, if your patients are going to change, you have got to be willing. If you're going to get a behavior change, you have got to show a patient respect. Now, the only way that I know to show a patient respect is to give them my time. And we're in a situation now where the present format where I see patients at the Cleveland Clinic Wellness Institute. It's for 85% of these patients come from outside the state of Ohio. So they cannot stay for days at a time. So we had to put together into one intensive counseling seminar for these patients, always and always, always with your spouse or significant other. You're wasting your time if you just talk to half of the couple. So these patients, in 6 hours, are going to learn all about the science and vocabulary that they can grasp and get their arms around. So that once they've got the science and they understand they have their disease because they have destroyed the capacity of their endothelial cells to make nitric oxide, they didn't have enough to protect themselves, and that they can be empowered to restore the ability of their nitric oxide production from endothelial cells by no longer injuring them, they get it. They absolutely get it. And why would there ever, and any circumstances you can think of when there's food, why would anybody who understands this say, oh, look, I haven't had this in a while, but boy, I'm looking forward to destroying some more of my endothelial cells. What? Nonsense. Anybody with heart disease and a brain in their head, once you have shared this information with them, they are empowered to absolutely to stop their disease. Yeah. And maybe I'm a little old-fashioned, but also 10 days before our seminar, my secretary gives me a list of who is coming with their phone number. And I always insist on calling them myself so that I can get my arms around their story. And they have an opportunity at the same time to ask questions of me, so that coming to the seminar, we have a strong platform from which we can all move forward. Well, as far as the mechanical procedures that we have going out there today, cardiovascular medicine is riding a wave on stents and on bypasses. And they're extremely expensive, and they can be quite dangerous. I mean, you can die getting a stent. You can die getting bypassed. That doesn't happen if you're eating whole food, plant-based nutrition. And there's no question, though, that I think we have to give due credit to the fact that when somebody is in the middle of having a heart attack, that an emergency stent or emergency bypass can be absolutely life-saving. But what about the other huge percentage of patients who are getting these procedures electively? The data aren't there. There does not appear to be any prolongation of life or any protection from a future heart attack with these procedures. And the reason is, especially what's understandable with stents, we now know that most of the heart attacks occur when a plaque ruptures. A plaque in the coronary artery, the cap over the plaque, becomes so eroded and so thin that it ruptures. So that now you have the extravasation, or the oozing out of, if you will, of plaque content into the flowing blood. And that's going to activate platelets, which are our clotting factor. So as the clotting factors are initiated, right after that plaque is ruptured, you begin to get a clot forming. And as that clot is in and of itself self-propagating, in a matter of further minutes, the clot now goes all the way across the artery, totally immediately blocks all the flow downstream, so that all the downstream heart muscle is now suddenly deprived of oxygen and nutrients, and that's how your heart attacks occur. Now, therefore, most people would agree that the plaques that are most vulnerable for this rupture are somewhat of the size of 5% blocking, 10%, 15, 20, 30, 40, 50. Those are never the plaques that get stented. The ones that are stented have to be almost legally over 75% blocking. And most of these will be 80, 85, 90%. These are not the ones that are at risk for rupture. So, in essence, when cardiology treats these patients with a 90 or 95% blockage, and they'll declare to the patient, "You're so lucky you came, you are a walking time bomb." Well, that's not really the truth, because the 90 or 95% block is not the one. That's going to cause angina and pain, but it's not the one that is most likely to cause a heart attack. And studies will careful studies will clearly bear that out. And increasingly, there is data that even some of the medical or the symptoms of angina and chest pain are not that radically at all improved compared to as if you were using drugs and medication and lifestyle change alone. And so it's very interesting how I think once we can really get cardiology educated to this, and they begin to really treat the causation of the illness, you will see fewer and fewer and fewer and fewer of these invasive procedures being utilized, because in addition to each one have the potential of mortality, I mean, you have 3% mortality with open heart surgery. Well, that means if you do 1,000 patients, that 30 people who are dead. You know, that's not something we can be necessarily proud of. Well, the interesting thing was that if you look carefully, they were not following. Our fat in our diet it is not meant to be a no-fat diet, but it's around 11%. Because when you eliminate the oils and the meat and the dairy, that's most of the fat. While there's plenty of fat to be healthy in our diet, it's down around 11%. The women that you're talking about in that study were up around, I think there was close to something like 29% fat. And the high-fat American diet is 34% fat. So the study was flawed and worthless. There are multiple problems how the typical Western diet injures. It injures by causing obesity. It injures by causing inflammation. It injures by causing diabetes. And then it injures by injuring the innermost lining of the artery, the endothelium, and its ability to make nitric oxide. Because when we start out as kids, and our nitric oxide level is way up here, and then right through childhood, teenage years, we keep eating this Western food that's punishing and injuring our endothelial cells, then our production of nitric oxide goes lower and lower and lower. And until now, as you've injured the endothelium, you have these cracks and fissures and opening in the endothelium. Now your bad LDL cholesterol can slip through into the subendothelial space, where it then gets oxidized to this small, hard, dense LDL cholesterol, which now creates this sort of cascade of oxidative inflammation as it gets gobbled up by these macrophages that come in to get rid of it. And then we have this entire cascade of formation of oxidative inflammation and foam cells and all the metalloproteinase enzymes that the foam cell makes that makes this disease even worse, like stromelacin, elastase, collagenase, myeloperoxidase. And so the Western diet really does a job on us. And the body is so remarkable that many people are able to put up with this until they're in the mid or late 40s, and then they are obese, then they've got hypertension, then they've got diabetes, then they've got heart disease, which is what? The end cascade of this absolutely tragic diet we're eating. And we're so misguided by all of the ridiculous advertising you see. I mean, have you ever watched television for a sporting event where you haven't seen something like a Big Mac cheeseburger with dripping off? I mean, that just is there's a heart attack on the screen waiting to happen. In my first book, I was pretty tough on people, you know, asking that we try to get everybody to get their cholesterol under 150. And that would, for those that easily did that, that would work. It's kind of a false way of getting it there by just taking a gorilla dose of statin and then getting your cholesterol down. That doesn't work because, look, no number has ever caused heart disease. Heart disease is caused by what is passing through your lips every day. It is going to destroy the ability of your endothelial cells to make sufficient nitric oxide. So in the new era, in the next book, we'll probably have to say something like this. Sure, if you're naturally, with the way you're eating, your cholesterol is under 150, you are going to be protecting yourself. But suppose that we had a situation where I had 1,000 persons who were totally 100% compliant with the with the disease, excuse me, with the nutrition form that I'm asking, whole food, plant-based nutrition. Those 1,000 people, they're going to be some that have a cholesterol of 110, some will be at 140, maybe 160, 180, 200, or 220. Now, what does that tell us? That tells us that each of us individually has a thermostat on our liver that more or less decides how much cholesterol that we're going to get. Because if these patients are not eating any food that are going to encourage the liver to make cholesterol, then the liver will make the cholesterol that it feels it needs. And I am increasingly not fearful for patients in that category, providing that they are maintaining the integrity of their endothelial fortress. So if somebody is eating absolutely beautifully, not in any way doing anything except strengthening and strengthening and strengthening their endothelial cells, even if they have a cholesterol of 190 or 200, they can't injure themselves because they have so protected and strengthened their endothelial cell. It is not being, there's no crack or fissure or opening or weakness where that cholesterol can slip into there and start this cascade of inflammation. So now on the other hand, when we do have patients with this familial cholesterol where everything is over 300 or 400, now we really have a problem. We got to do what we can to help those patients lower their cholesterol. You may want to possibly use some medication in those patients unless they're absolutely insistent on not taking it. And in that case, you can get them to really tighten up the good whole food plant-based diet in ways that offer them the greatest assurances they're doing everything they can to strengthen their endothelial fortress. The reason I have trouble with the government levels is that they really, it's really, they're missing the entire point. Again, I'll say it, and I apologize for being redundant, but no number has ever caused heart disease. And if they say it's 200 and then it's 130 for your LDL or something like that, there's no mention at all there, none whatsoever, of your endothelial cells and protecting them. So if somebody happens to have a cholesterol that's over 150, but they're absolutely not eating anything that is going to injure their endothelial cells, that they're building their endothelial fortress, then I think they're protected. But I think just to throw out a number and not explain what really causes this disease is not really telling the whole story. Yeah, I think if people don't have heart disease, but they want to eat nuts and seeds, that's fine. But these have an awful lot of saturated fat, so I guess I can be a little bit of an outlier here. And if I have patients seriously ill with heart disease, I do not want them to eat peanut butter and cashew sauce and nuts. How many people do you know who will eat one nut? Nuts are highly addicting, and they have a lot of saturated fat. And so right now that we are getting absolutely very exciting and stunning results with the patients that follow our program. And so I have yet to see a single program on nuts where you take patients who are seriously ill with cardiovascular disease and pour on the nuts and all the seeds and the cashew sauce and the peanut butter and have them halt and reverse their disease. I've not seen that. But for patients who don't have heart disease, I don't have a restriction on their having those. But for the patients that do, I feel very cautious. And if down the line I'm proven to be wrong, I have not hurt my patients. Well, I think there are multiple studies that clearly show that dairy is one of the worst things you can do in terms of what it can do for tumor formation and what it can do for atherosclerosis. Can you imagine a patient with heart disease being asked to eat ice cream and cheese and yogurts? No, and butter. I mean, it just is absurd. Now, dairy is a food that has got to go. That's now, just in wrapping this up, the reason that I find that I'm perhaps more passionate than ever about medicine is because I really feel that we are at the moment on the cusp of what I call a seismic revolution in health. And this seismic revolution in health is going to come about because, well, we've talked about heart disease today. Whole food plant-based nutrition not only gets rid of heart disease, it gets rid of hypertension, it gets rid of diabetes, it gets rid of high cholesterol, it gets rid of the risk of stroke, of vascular dementia, Crohn's disease, osteoporosis, and ulcerative colitis, rheumatoid arthritis, lupus and multiple sclerosis, allergies, asthma, kidney disease. I mean, the list goes on. We have never before have we had in medicine's toolbox a therapy that is so safe, so void of hideous side effects, so inexpensive. And it's up to us in the profession to find the will and the grit and the determination to share with patients the lifestyle and most specifically the nutritional literacy that will empower them as the locus of control to absolutely annihilate 80% of chronic illness. Thank you.